I think healthcare, as I travel the state, is one of the overriding issues that voters want to talk about. And I see healthcare really in two big buckets. And really the largest long-term issue to me is how poorly Tennessee performs in almost all health indicators. Whether it's obesity, heart disease, deaths at birth, we're generally ranked in terms of the states between 40 and 50. And so I think if we're going to get a handle on our healthcare problems, we really have to do more in preventative care and encouraging people to live healthier lives, and to use public education as a way to help people understand the decisions they make and the ramifications it has on their health. Then secondly, I would mention access to health care, which for a variety of reasons is on people's minds. I think largely because of the efforts to repeal the Affordable Care Act in DC, but also I think the failure of the legislature to do the Medicaid expansion. I think people are aware that the state has lost somewhere between $3.5 and $4 billion in money that could have been used to make health care available to people with pre-existing conditions, disabilities, low incomes. And they also understand that as a result of that, we have people without insurance, but we also have people who are receiving care and there's no reimbursement, and we've had 10 hospitals close in our state since then, which is second in terms of hospital closures only to Texas. So I think those issues about us getting more access to Medicaid dollars or finding ways in which we can manage around this issue, that is also a huge concern and something I'm very interested in. One of the things I tried to do as mayor, I got very interested in healthier living, particularly around the issue of obesity. And so, we use, I guess, the bully pulpit of the mayor's office to encourage people to exercise more, to walk, run, get any sort of exercise, take advantage of the parks and resources we have here in Nashville. We also had grant money that we used to encourage people to eat better, and tried to work on the food desert problem. I mean, if you look at just sort of life, I think one of the things we need to do is focus a lot on not just pre-K to 12, but those years from birth to when the child enters school. And having the ability to maybe have more visits to the homes of new parents who need help understanding what their role is as a parent and how to support and raise a child would be useful. Looking at danger areas for young kids in terms of economic issues or home issues, I think are important. I mean, clearly, I think sometimes we forget that if you invest those dollars early in the health of young people, you're going to be saving money on the other end, and also I think creating a safer and better society. I think on the sort of the adult range of things, I mean, obviously people make choices, and there's a lot of free will and there's a lot of personal responsibility. I mean, I know I should exercise and eat well. I love to exercise, but I don't eat well, and I still, when my family's having pizza, I'm getting nervous when the last piece is there, like who's going to get it? And I know that, and I take the responsibility for it. But with young kids, in particular, and kids all the way up through in high school, a lot of them don't understand what we understand we need to be doing, and I think that educational aspect in terms of helping them, eat right, exercise, is key. Information about different medical conditions, whether it be diabetes or whatever, is absolutely essential to get out to folks. One of the things I tried to do as mayor, we wanted to make the healthy choice an easy choice. So you would have access to greenways and parks, design buildings so people took the stairs, make the healthy choice of getting a little bit of movement in your life an easy choice. And I think that's the type of stuff we need to be doing. My goal would be to be open to stakeholders and to meet with them and to get their ideas and to get their thoughts about anything that we were thinking of proposing, because it can only benefit it. You know, I've had 8 years of experience as mayor, running a fairly large government, and you know, I know not everything I did was perfect, and probably some of the mistakes I made is when you don't talk to stakeholders in advance, when you don't reach out to people and get their thoughts and see how you can improve what you want to get done, because you're going to hear those concerns sooner or later, and it's better to get people on board at the beginning and come up with a better piece of legislation. I've read statistics about the projections that by 2030, the United States will have a physician deficit that will be problematic, and part of that's the aging and other factors. But you know, my sense is that if we don't have one, I would think we at least have a distribution issue, which I think we have in a lot of different areas. So you have a state like Tennessee with major metropolitan areas and then substantial rural areas. I think what happens is the rural areas tend to be shortchanged. Well, for me, I mean, obviously the federal government plays such a huge role in this. And you know, where we are now, I don't know in January of next year where the Affordable Care Act will be. I mean, I don't think anybody knows. But it'll probably continue to be diminished. And I think the next governor is going to be in a position where, because of the decision made not to do the Medicaid expansion, we will simply be getting less federal dollars for health care than other states. And I think the next governor, his number one, has got to be an advocate for our state. And I think the next governor has got to think in terms of, we can't always wait for the federal government to come in like the cavalry and solve our problem. I think we got to look for creative solutions. And so going back to this idea of talking to stakeholders, I think, you know, working with the medical profession, with hospitals, with universities, with medical companies, to try to devise ways where we can maybe control costs and but still make more health care available, to me is something I want to look at. I mean, you got to get the dollars, but I think trying to think outside the box is important. But it's going to take not just the state of Tennessee's government, but the whole medical field, philanthropic community, and others to work through these issues. And then not to give up on the federal side of it. I mean, we've put ourselves at a disadvantage. I mean, you know, other states are just getting more dollars than we're getting. The hospitals that are closing or the ones that are on the verge of closing, I think you look at public-private partnerships, you look for ways to bring in nonprofits and other groups to help. I mean, I think you've got to, at the same time you're doing this, you've got to start thinking about how we do rural hospitals so that they can be financially viable. I mean, you've got to make sure that they're the appropriate size, offer the appropriate services. But when you think about a rural hospital and its closure, I mean, think what that means to a community. Your hospital closes, it's really hard to keep people living there. It's really hard to attract new people, and it's really hard to attract business. And not only that, on top of that, you lose all the employees in a hospital, which is usually in the more rural counties, one of the more significant employers. The concept of a team effort to me is an appealing one, and certainly I think physician-led would be highly desirable, with the possibility of having the flexibility where sort of mid-level folks could also perform that role where it's appropriate. But I think those decisions are best made by the medical profession. I mean, getting their input as to how that should be done, because certainly the profession knows far more than lay people like myself. Well, you know, my sense of it is this. I think, number one of the things we need to do is have a very large public education campaign around the dangers of opioid use. And I still think there are lots of people who just don't understand the dangers, and I think a lot of young people don't understand the dangers. And so I think you need an education campaign similar to anti-drunk driving or anti-smoking, where you use the media, use schools to get the word out so that there's a broad-based understanding of this, how extremely dangerous these drugs can be. I think, clearly you have to have a control over prescription and, pain centers, and there's too much medication getting out into the system. I think treatment is a major component of this, and the governor has made some steps on that. I think we need to do more. First, I was happy that the governor came forward and took action. I'm not sure that we have put enough money into it. I think the magnitude of the problem and what I've seen other states do and other hospitals do is more than what we're doing. And I think the problem in Tennessee is certainly significant, and I want to make sure that the treatment side of it is getting the funding that is necessary. That's my major concern going forward. And then I think there's a law enforcement part of this. I mean, there's the opioid crisis, and then that's sort of merging into fentanyl with cocaine, heroin, and there are people who are profiting from selling illegal drugs that are causing untold misery through the deaths and injuries it causes families. So law enforcement needs to be given the tools they need to enforce the law. Well, I think the more we can do with residency slots, I know the federal government has a role in this, the better for our state. And obviously, we have medical schools in the state that I think would benefit from that. And I agree. I think when you go off a residency, you're already working, you're becoming part of the community. That's where you're gonna want to settle. And I think Tennessee is an extremely attractive place. If you came here to go to medical school and do a residency here, will probably win you over during that time period. Well, I just encourage folks to look at our campaign. It's karldean.com, Karl with a K. Healthcare is something I care about. I think it's, in terms of what we do as a society, as a civilization, it ranks up there at the top. I mean, we're talking about quality of life. We're talking about the length of people's lives and the lives of their loved ones. So there's nothing really more important than that.